Can anesthesia during dental work cause problems? Hi, I'm attorney George Tate. I've been an attorney representing people that have been injured by their dentist for over 20 years here in the state of Utah. Anesthesia ranges from what we all know as freezing in our mouth from lidocaine or Novocaine, all the way up to what they call conscious sedation, drugs through an intravenous line in your hand, all the way up to general anesthesia, which is what we're all familiar with when people go to surgery. Tube down your throat, you're totally out of it. Often children get conscious sedation. And some people that hate dental pain also get conscious sedation or general anesthesia. And I'm kind of leaning that way myself, haven't had a lot of dental work done. Nonetheless, let's talk about the injuries from anesthesia. The shots that you get, they can cause injury, but usually, almost always, it's transitory. A very small needle, a very fine needle, is used to place the drug around, supposed to be around, the nerve. Sometimes that needle can go right into the nerve and the drug can go right into the nerve. Very, very seldom happens. Okay, and really shouldn't happen if the dentist knows what he's doing, and anatomically you can go in there, you're supposed to know where the nerves are and avoid injecting in or around the nerve. Conscious sedation is where they put an intravenous line in your hand, usually, or sometimes in your, what they call the anticube in your elbow here, and they give you drugs. That kind of puts you out of it, but not totally out of it. That's why it's called conscious. You're with it, but you're sedated. You don't really remember what happened most of the time, or at least you shouldn't. The problem with conscious sedation is that it needs to be monitored closely, because they can give you enough drugs that it stops you from breathing. And that's a problem, because you gotta breathe. You gotta have oxygen to supply your brain. The third type is general anesthesia. So general anesthesia, they put a tube down your throat, or if they're working on your mouth, of course, the dentist, it'll a tube in through your nose and down your trachea into your lungs, and they put you totally out. Then you're in the total care of the, should be, anesthesiologist, oftentimes a nurse practitioner anesthesiologist. Now, when you get general anesthesia, you'd think this was always done in a hospital with, proper monitoring equipment and so on and so forth. That's not the case usually. Usually it's in a dentist office, and the anesthesiologist or nurse practitioner will bring in their equipment and monitor you right there in the dentist office. Of course, what can go wrong there is that you're mucking around with vital structures, trachea and so on, never mind having to be monitored correctly, but things can go wrong. And they have to have the equipment there to look after you properly. If they have to bag you, if your trachea swells up and closes off, they have to be able to do a tracheostomy, often with what they call a jet vent that puffs air into your lungs. Call the emergency system and get you looked after right away. Happened to a client of mine, conscious sedation, too much drugs, stopped breathing, suffered a mild traumatic brain injury from lack of oxygen. Bad injury, didn't need to happen. Sad case again. Crazy to me that the dentist or the anesthesiologist doesn't take the time to properly monitor the patient. Anyways, if you have questions about dental anesthesia or something happened to you bad as a result of dental anesthesia, we're happy to answer your questions. Simply give us a call, reach out to us. Happy to answer any questions you have. Take care out there.